Good day, Dr. Garbo, distinguished panelists, and colleagues. My name is Dr. Rapiti, and today I'm privileged and honored to be invited to speak at this historic occasion. I'm a frontline practitioner with over 4 decades of experience working in a resource-limited settings of Mitchell's Plain. Today, I shall share my clinical experience from the COVID era, particularly those related to the vaccine-associated injuries. My aim is to advance discussion and improve patient care all over the world, and at the same time to illustrate the grave atrocities that was thrust upon the entire society during the COVID pandemic. I need to declare that I have no conflicts of interest. I need to share this with you. It's a quote from Einstein. Books can teach you a lot, but they cannot compare with the lessons of experience. Frontline doctors ignored for too long. It has been my observation as a doctor and frontline doctor, the medical hierarchy and dictatorship sidelined frontline GPs for over half a century. And as a result, society lost from the gems that were discovered by these great physicians. This slide is a broad overview of the vaccine injuries, which my talk is about, that I've treated successfully and some not so successfully. And I've categorized them according to the systems: CNS, cardiovascular, gynecology, and dermatological, as well as cardiology. My first case is a 27-year-old female. She had COVID, took the vaccine, and she took that to protect her elderly parents, thinking she was doing the right thing. 2 months later, she developed a diarrhea, and shortly after that, she became paralyzed through her entire body. She was then taken to hospital, given Polygam, and she was merely told by the doctor that she has Guillain-Barré syndrome. She felt neglected in hospital. The nurses didn't really bother about her. She was discharged to a rehab center and was sexually abused by a nurse. And at that point, she became extremely depressed and asked to be self-discharged. She had no follow-up by the state, and I met her on a Zoom and managed her on my protocol. My protocol was using ivermectin, SSRI, fluoxetine, vitamin D in high doses. She also had asthma, which I treated her. You'll notice I didn't use too many medications because I believe that less is more. If you can achieve your goal with using less medications, why use more? Furthermore, these patients were financially embarrassed. They had no money, so one couldn't impose huge amounts of cost by scripting a variety of items. While her response to treatment was within 2 months, she was able to walk on her own. She studied at a college, and she was trying to get compensation. I did the consultation virtually because she lived about 2,000 k away. It's 3 years on. I haven't heard from her, but I presume that she's doing pretty well. She's trying to lodge a case for compensation. My second case was also Guillain-Barré. She's a 50-year-old female school teacher. She had COVID, and then she decided, out of a citizen's duty, to take the vaccine on the advice of the Department of Health and our president, warning us and advising us to take the vaccine. 2 months later, she developed severe weakness in all her limbs. She collapsed at home. She was rushed to a hospital, which was about 30 kilometers away from the main hospital. On her way to hospital, she had 5 cardiac arrests. She had to be cardioverted at each occasion. She landed in ICU. She had told me she had quite a torrid experience being in ICU. She was never told her diagnosis by a treating doctor. She was discharged in a wheelchair with no follow-up and left on her own. I met her via Zoom meeting for the vaccine injured, and I established from her history that she had Guillain-Barré. She was very pleased to learn that at least there was a name or diagnosis to a condition. I explained to her what really happened, and for the first time in an entire episode, she learned what was going on with her. I commenced treatment on my protocol as I did with the previous patient. So besides weakness, she also had a sensation of a fly crawling over her forehead, which is unusual, but it would seem that vaccine injuries to the nerves can come with a wide array of symptoms. There's no fixed pattern. This sensation kept her to sleep. She was distressed and depressed. She was told by a psychiatrist she has a mental problem. She felt very insulted by that. She was explained for the first time on Zoom that she had GBS. She felt relieved to know the diagnosis. She was bitter about being dumped both by the government, by the hospital. In the process, she lost her car, she lost her job, and had to let go of her housekeeper. A son was a teacher, decided to stay home and care for his mom. He lost his job in the process. I treated them again via virtual consultations because she too lived about 1,500 k's away from me. I use the same protocol for vaccine injury. It is pretty standard in my practice at the time and even up till now. I'm pleased to say she regained 80% of her function in a voluntary muscle in about 3 months. She did have comorbidities, diabetes and hypertension. Her own GP refused to acknowledge that vaccines were the cause. She returned to her job as a teacher 6 months later. However, she stopped working due to a heart condition. I treated her polio. At the moment, she's trying to obtain compensation. My next patient was a patient with Bell's palsy. She was a 35-year-old female. She was treated for COVID pneumonia in the practice very successfully. She was delighted. But when she went back to work, she was forced to take the COVID vaccine, developed right Bell's palsy. And with that, this is very unusual. Those of you treated Bell's palsy, it's not usually associated with pain. But in this particular instance, she had excruciating headaches that kept her up at 2 o'clock in the morning. She became depressed because of the facial appearance. She was bitter because she was forced to take the jab. Employer took no interest and didn't support her in any way. And she eventually lost the job to absenteeism. I started on anti-spike therapy, which was ivermectin, vitamin D, supplemental medications, and she recovered from a Bell's palsy and pain after 6 months, and she found herself another job. My next patient is a 65-year-old female with a health worker who retired from her hospital, and she was forced before retiring to take the jab. Later developed severe trigeminal neuralgia. She was kept awake at night. The hospitals couldn't help her. She came to me and she regretted taking the vaccine bitterly. Was put on an anti-spike therapy and carbamazepine. She recovered completely after a month. I haven't seen her in 3 years, so presumably she's doing very well. This next patient is a very interesting patient. She has a condition called stiff patient syndrome. She also had a CVA, and the name Celine Dion should ring a bell to those of you who've watched her life story. She had this condition and struggled to recover. I think she did, but I don't know if she had. But anyhow, she is a 40-year-old female. She had severe painful spasms, generalized for 6 months. She was suicidal after taking the jab. The state hospital dismissed the symptoms as a neurological disorder with unknown etiology. God only knows what that means, but anyhow, it's a lot of gobbledygook that says nothing. They offered her no treatment or any help. I started on anti-spike therapy, and I did something called needling, which relaxes the muscle spasms. She enjoyed full recovery in about 2 months. She later developed a stroke, never had hypertension. In the time I've treated her, she never had hypertension, so I suspected that the stroke was part of the vaccine injury. As you know, that one of the side effects of the vaccine, the spike affects the endothelium of the blood vessel, and platelets collect and causes a stroke. Put on spike therapy, anti-spike therapy again, and was and she made a full recovery within a month, and she's completely free of stiff patient syndrome and a stroke. This next patient is somebody who's had intractable brain fog. Is a 40-year-old college lecturer, very well informed about vaccine, about COVID and treatment, highly read. At some instances, he taught me a thing or two, and I think we need to be humble enough to realize that our patients are not as dumb or are ignorant of what's going on. He self-medicated for a year, but he still, and his bill for his supplements was $2,000. He came to me in a very distressed state, feeling that he wasn't succeeding because it was interfering with his work, his concentration as a teacher. Became terribly depressed. Then I put him on ivermectin, and I've learnt recently that he's one of the only patients that's been using ivermectin low dose. For some strange reason, his body he seems to have gotten feeling a very muggy effect if he took high doses. He's the only exception to the rule, but generally I've used very high doses of ivermectin, and you could without any serious side effects. I've added fluoxetine to the treatment, and he admitted it helps. And I use this on the basis that fluoxetine is not so much as an antidepressant, but it had anti-inflammatory properties, and I suspected the spike protein was affecting his cerebral functions and causing an inflammatory process, which fluoxetine seemed to have helped. I tried him on augmented NAC, which was suggested by the famous Tina Pierce, who apparently claims that it was outstanding for brain fog, but this didn't quite work for him. It's extremely expensive. He's been using bromelain because bromelain, we think, also dissolves the spike protein. We use nattokinase, CMOS, vitamin D and C. He improved significantly after being on my treatment, but he's still symptomatic. There are moments when he has these dull moments and it depresses him. And I decided on this occasion recently to start him on clopidogrel because remember the spike side effect one of them is it's vascular, and clotting is one of them because his spike antibody body test was 1700, highly suggestive that it was a spike protein side effect. The next patient who had brain fog was a 50-year-old female. She was treated successfully COVID pneumonia. She was forced again to take a vaccine by employer. She became very ill after 2 Pfizer shots. She had dizzy spells. She was disorientated, couldn't drive to work. She was depressed and angry that she was cured of COVID, and why did she have to take the vaccine? We started on anti-spike treatment. She too was put on an SSRI. She took 6 months to settle. She still has occasional bouts of dizzy spells, but she's off most treatment. But at least we've made some progress in her case. As for cardiovascular thrombus, I had a 42-year female successfully treated for COVID pneumonia. She was forced by an employer to take the jab for an insurance company. A year later, she developed grade 3/4 dyspnea on exertion. She also had asthma, but in this particular instance, the asthma didn't explain the dyspnea on exertion because she did not have any bronchospasms. But on chest x-ray, she definitely had an enlarged heart. I suspected myocarditis even though the blood test came back negative. S proteins was also high. It was about 1800. The BNP was normal. I put on anti-spike treatment, and treatment for congestive cardiac failure. She made full recovery within about 2 months. Her heart size reduced to normal. She's off all her meds and she's perfectly well. So this was one very good successful story where somebody has had what I suspected, a cardiomyopathy or myocarditis, and recovered after being put on. I've put this for reference. It's a study done by McCullough and colleagues, and when they found that 76% on autopsy, which is the gold standard of making a conclusive diagnosis, that the COVID vaccine or the spike from the COVID vaccine was definitely implicated in 76% of the autopsies to cause heart failure, myocarditis. So there you have it. Microclots of the toe. This was a 47-year-old female who also had COVID, successfully treated, was uh, forced to take the vaccine. She presented to me with severe pain in the right big toe for almost a year. I couldn't think what was the cause, whether it was a soft tissue injury. We did x-rays, we forced nothing. She was incidentally forced by the lab that she worked for to take the vaccine. Seen by a rheumatologist, and he diagnosed microclotting, put on heparin, the pain settled, and she did pretty well, and he wanted to put on it permanently. I put her on ivermectin prophylactically for a month. She stopped the warfarin. It's 18 months later. She's off all medication and she's perfectly well. And the take-home message in this particular instance, if you find or you suspect microclotting, it's worth trying anticoagulants and see what the result is. And ivermectin is your go-to start-off drug, and you can use the other anticoagulants like the Dox and the clopidogrel and see what comes off it. Vision loss. Here was a case of microclot. 55-year-old truck driver took two Pfizer jabs at 3 a.m. in the morning. He went to the bathroom, and on his way he found the vision in his right eye blurred, and he lost complete vision in the right eye. He was completely worried that he would lose his job. I suspected clotting in the micro vessels of the eye. I started him on anti-spike treatment. In this particular case for clotting, I generally use ivermectin, and I use them in pretty high doses, and he regained full vision within a week. He was referred for good measure to the ER and to an ophthalmologist who denied the vaccine was the cause, gave him no treatment, sent him home. Well, I'm pleased to say 3 years down the line, he's doing very well. This is an interesting set of patients that I've seen. Generalized papular urticaria. There were three of them. The first one was a 72-year-old female. She had two Pfizer jabs, and shortly after the jabs, she developed severe, persistent, unbearable generalized urticaria. She didn't have a single night's rest for 2 years. She was so depressed. She was suicidally depressed. She said to me, I would rather die, when she came to me for help. I treated her with anti-spike treatment for a jab injury, and I also treated her for MCAS, that's macrophage cell activating syndrome. And there I used high doses of acetamide, which is cetrizine. I found that to be quite an effective drug for MCAS syndrome. And yeah, I think one shouldn't be shy. I use twice the recommended dosing. So 10 milligram once a day. I use 10 milligrams twice a day. And within about a week, she had a good night's rest. There was remarkable improvement. I also used nicotine patches because it is thought that the spike protein attaches to the S2 receptors, and what the nicotine does, it displaces them. My other patients with brain fog, I also use nicotine patches, and I kept on treatment for 3 months, and thereafter we stopped all treatment. She has complete recovery. It's 3 years down the line. She's doing extremely well. A 70-year-old man and a 45-year-old male, both were suffering for 2 years with generalized itching. One lost his skin was almost excoriated, and I thought he had papular urticaria with MCAS. We used the same treatment, antihistamines, both of them recovered within a month. I haven't seen them. Presumably they were both well. In terms of pregnancy and miscarriages, I had two females in the 20s who miscarried, and one 45-year-old who had an intrauterine death at 8 months. She was utterly depressed because she was perfectly normal. There was nothing wrong with the fetus. And then I had a 27-year-old teacher was gravid at 3 and para 3 minus 2 because she had 2 miscarriages after the jam. She became depressed and couldn't cope. I put her on anti-spike treatment, ivermectin, and advised them to try and conceive. And she delivered a full-term normal delivery baby without any complications. We stopped the ivermectin once she conceived, rather interestingly. And she brought the child to me, and she was 8 months old, and they were totally thrilled by their result. Turbo cancers is another one, and I must say I've not had great success with. Both of them had colorectal cancer, 2 cases, and the one was a 40-year-old male librarian. He was forced to take 3 jabs, developed stage 4 colorectal cancer with severe secondaries to the liver. He was discharged with terminal cancer with no further help, was brought to my rooms, confused, could not speak, and was wasted. Was commenced on ivermectin, fenbendazole, vitamin D3, and advised a 12-hour fast to encourage autophagy and put it on a ketogenic diet. He made excellent recovery, returned to work within about 3 weeks, and I was amazed that here was a man that looked so moribund, was able, and the 13 centimeter lump he had in the liver reduced to 2 centimeters, to the surprise of his treating oncologist. He told the oncologist that he prayed at night because I warned them not to inform them about our alternative treatment, lest we have the FBI on our case. So in his case, I did a follow-up 1 year later. He worked for 1 year, went on a holiday, but he suddenly had developed secondaries in the cervical spine, and 2 months later, after a long battle, he demised. The second case of colorectal cancer was after a third jab. Was a 45-year-old male, 54 years. Is a 45-year-old male. That's a mistake. He had stage 4 colorectal cancer, and after the COVID jab, unfortunately, he died after 3 months in spite of intensive treatment from the practice. Breast cancer. These were no jabs, and I added this for good measure to show the efficacy of ivermectin in treating cancer. I had 2 patients with breast cancer, times 2 females, both refused chemo, both recovered completely after treatment with ivermectin and fenbendazole within a period of 2 months. When they returned to their oncologist, they found no trace of cancer. I now would like to make some comments influenced based on my array or smorgasbord of vaccine injuries. And I think my first comment was that we are at the tip of the iceberg with vaccine injuries, with almost 8 billion vaccines given, and with so many side effects that are not being reported, but people are suffering them. I believe we have a pandemic of the vaccine injured thrown under the bus. I feel the vaccine was of greater risk than benefits. It really was of no use. According to Dennis Rancombe, whom I trust for his acumen and knowledge, he's made a comment or a study showing that there were 17 million deaths as a result of these vaccines, far more than COVID itself was responsible for. The FDA recently released a paper. It was one of the members of the FDA who did the study said that 10 out of the 100 reported, it was Professor Vinay Prasad, a well-known professor of epidemiology from University of California working in the FDA, stated that 10 out of the 100 reported COVID deaths were due to COVID. And this, sadly, was only done by the FDA 5 years later. It raised a good question mark. Why 5 years later? This is just a little bit of information that states quite clearly and emphatically the vaccine was not safe and effective. My advice would be that frontline doctors should identify by having a high index of suspicion with any kind of symptom that sounds out of the norm. There's good treatment, it's simple, it's inexpensive, and it is safe. I believe the vaccine injured need to be heard and be helped. COVID and COVID vaccine injuries opened a can of worms. I believe ever since I got deeply involved with COVID, I made it my business to understand vaccines, not just COVID vaccines, but all vaccines. And I believe that COVID was a treatable condition. And as such, the vaccines were not safe, and as such were not really necessary. If vaccines were really safe, why were manufacturers indemnified? I feel they should not have been indemnified. The other thing is, after 6 months, vaccine immunity was lost. So how can one say one is being protected if one took the vaccine? And we need to stress quite categorically, it was Omicron and not the vaccine that ended the pandemic. We were not told about the vaccine ingredients. They were not divulged to us. But we do know some of the toxic substances was lipid nanoparticles, graphene oxide, and SV40, which has the propensity to cause cancer. Also, the methodology used to produce the vaccine for mass production was using E. coli, which was not mentioned, and no studies were done on it. And E. coli, in more than its allowed limit, was found in many vials. The mRNA was found in a study done in Amsterdam, was found to move found in the liver cells, in the RNA. So it is a matter of speculation how this mRNA could influence the progeny of the individual who has the mRNA spike in the mRNA of their cells. A Norwegian study showed that there was a great inconsistency in the dosage, and that was never mentioned to the citizens or the community. And in that inconsistency, they found the people with the highest dose had the highest incidence of toxic events. And the Norwegian government was completely mum about it. And the researchers, the scientists who did the study, were gaslit, and they had their paper pulled down. We need to also ask ourselves, why did Pfizer and the FDA want to conceal the vaccine data for 70 years? We know the reason. The data was finally released on a FOIA insistence to the court, and was found there were 1,200 deaths associated with it. There were 1,290 side effects, and the participants who took the vaccine had 43,000 side effects. So there's no way, with this kind of information, one could say safely that the vaccine was safe, or was it effective? My concerns about vaccines there were excess deaths after vaccine rollout. Ed Dowd has been somebody who worked for BlackRock, did a study, and he concurred with the finding of First Insurance that in the 20 to 60 year group, there were more deaths reported than the number of deaths in the 10-year Vietnam War. And this was unusual. And that the number of deaths was the 60,000 deaths in the US in 1 year after the vaccine was unprecedented. And the excess deaths were seen in many other countries, in Australia, in Canada, and in Japan. There was a spike in cancers that were in remission suddenly relapsed, and there were turbo cancers. And we was found in a Japanese study, the mRNA was all over the body, ovaries and testes, traces in the breast milk. It was detected 2 years after vax, when it was told to us that it will be located and remain fixed in the deltoid muscle. Oh no, it went to every part of the body, right to the ovaries and testes. The cause of death from myocarditis, McCullough, I mentioned this before, 76% were due to the vaccine based on their autopsy. Even the late Professor Ann Burkhardt found that 15 out of 16 patients from 62 who died of heart attacks, the mRNA spike vaccine was found to be responsible for those deaths. The vaccines under the spotlight, I read much of my information about vaccines reading the following books, and I would recommend them. Vaccines Amen by Aaron Sari, Forbidden Facts by Gavin De Becker, was a investigator. He's a criminal investigator, but he's done a deep dive and done an excellent book with great references that exposes the lies about the childhood vaccines being tested and safe. Turtles All the Way Down, the Pfizer documents, analysis by Naomi Wolf and colleagues, and the other book, Vaccines Mythology by John Leakey, who was an investigator, and the famous Dr. Peter McCulloch. I would urge you to read those if you are interested. Some facts about the vaccine that makes me worried is that none of the vaccines have been tested for safety using placebo. That includes the childhood vaccine, and I think we need to bear this in mind. The Institute um, of Medicine admitted when they were asked by the CDC to conduct a study to show to demonstrate whether the vaccines were safe or unsafe. And all they could do, they did no study, and all they came out saying that there was no study to show the vaccines are unsafe. By the same token, one could say there's no study to show that the vaccines are safe. And that was done in 2015. So nothing was done, and they had time. The study done by the Gerald Ford Institute on Vaccines, 10 years of data, was done by two accomplished scientists. And what they found, the vax had 7 times more visits to clinicians than the unvax. The vax had more chronic illnesses than the unvax, and there was no cases of autism in the unvax. The study was requested by Del Bigtree, and the scientists decided not to publish this paper because they feared that they would be gaslit and they would lose their job. But Senator Ron Johnson had a hearing of this study. It is widely known. Go onto YouTube and you'll see the actual story about this case study. I'd like to single out Stanley Parkland, was regarded as the father of vaccines. He was grilled for 9 hours by Aaron Suri, who was a barrister who specialized in vaccine injuries. And Stanley Plotkin admitted in that hearing under oath there's no evidence that vaccines, that is the child, do not cause autism. And we know there are many studies, but they aren't published in your mainstream journals. He was prepared to say or lie that the vaccines were safe, even though he knew there were no studies to show that they did or didn't cause autism. He also admitted in that study Gardasil was only studied for 5 days before being approved. Now, this is highly unacceptable. You cannot approve a vaccine on just 5 days of study. The WHO made a claim that vaccines saved 154 million lives. There's a huge question mark. There was no proper study to make this claim. They merely did computer modeling. The WHO also stated this claim cannot be substantiated or verified. So it was really a Facebook post, and this is reckless to make such a claim. It is to bludgeon people to take the vaccines to show that they have been of benefit. The truth is that the mortality from infections dropped by 95% before the introduction of the MMR. So too much credit is given to the MMR vaccines for reducing childhood deaths or childhood mortality. And the reasons for this is better sanitation, housing, purified water. And from the 40s, 20s and 40s, we were having motor cars, so there was no horses as the main form of transport because they were dropping something like a couple of tons of dung, and that you could imagine what damage it was doing to infectious diseases. Autism and vaccines is a serious issue that we should all be concerned. The definition of autism is imprecise. There's no doubt alum and Tylenol are implicated. If we can't prove it, we need to study it because there's definite evidence if aluminium enters the brain and which it can in a young child with a poor blood-brain barrier. It can cause inflammation, encephalitis. It could cause epilepsy and all kinds of neurological disorders. And a study that was done by the CDC in 2013 and was mentioned by the scientists who did the study that when they repeated the dose of MMR in black children early, there was an increase, especially in the males, by 300%. So there you have it. I'm not saying that MMR caused it, nobody say them, but it's an area for suspicion. It ought to be investigated. And here's some data about autism. In 1980, the US had 5 vaccines. The incidence of autism was 1 in 10,000. By 2022, there were 70 vaccines. And of course, without indemnity, with the indemnity they were granted, vaccines were just pouring out by the dozens. It was big money. Pediatricians were making big money. Now that figure in 2022 has dropped to 1 in 29. If that's not a pandemic, I don't know what is. It's a serious matter because 80% of them regress. Parents are held hostage for life with an autistic child. And it's expected that it'll cost $1 trillion a year extra to care for these children. Think of countries that don't have these resources. The recommendations, I think, vaccine safety studies with placebo control trials must be conducted. I don't think we can accept it carte blanche that vaccines have saved lives and they're a must. I think one should have a choice. We need to do studies on efficacy. We don't need to do new studies. We just need to look at the vax versus the unvax. And already there's the Gerald Ford study to prove that the unvax had better outcomes in the long run. And so did Paul Alexander, pediatrician, who did a 10-year study with over 10,000 of his clients and found similar results. Toxic ingredients like alum must be removed from vaccines, and manufacturers should not be granted indemnity. And we should stop gain of function. It should be made a punishable, treasonable offense. There's only a mad person, a mad scientist would engage in activities like gain of function, where the process is to make an innocent virus more virulent that it can be fatal. In other language, that is actually that's a murderer on the loose. I think we should investigate associations, medical bodies that are sponsored by drug companies. The Children's Health Defense is busy taking the American Association of Pediatrics to court for misleading the American public. I think parental consent is essential. Nobody should push it down a child's throat to take a vaccine without parental consent. The parents need not be doctors to make that decision. They can read and equip themselves and make the decision, because should there be a side effect, as we've seen in COVID, it is they who bear the brunt, not the state, not the doctor, and not the sponsors of these vaccines. I think we should reinvigorate the Nuremberg Code, and our Constitution should be respected. Well, in conclusion, I hope you all agree that the entire world was assailed by one of the most heinous crimes in human history during COVID. The call to action, the responsibility now rests with all of us to ensure that this never happens again, and to ensure all those responsible are held accountable. I thank you for your attendance, and I welcome any questions. Oh, shit. Good day, Dr. Garbo. Distinguished